Picture this. You're 70 years young and full of energy. Retirement looks bright with plans of travel and hobbies waiting in the wings. But then there's that annual checkup looming. As your doctor begins reviewing the standard battery of tests recommended for your age, a nagging question arises. Are these tests truly necessary? Or could they be harmful, leading to unnecessary stress and potential health risks? The truth is, as we age, certain medical interventions become more problematic than beneficial. And it's crucial to understand which ones fall into this category. Today, we'll be diving into 5 health checkups that many doctors now consider outdated and potentially harmful for individuals over 70. These are screenings that have become so ingrained in our medical system that most people assume they are necessary. But the reality is, there are growing concerns about their effectiveness and safety, especially in the senior population. We'll delve into the reasons behind why doctors are rethinking these tests, the potential risks involved, and what you can do to make informed decisions about your health. This isn't about fear-mongering or distrusting the medical community. It's about taking control and ensuring that the tests we undergo are truly beneficial. So if you're 70 or approaching this milestone, it's time to tune in. Whether you're in great health or dealing with health concerns, this information will help you navigate crucial conversations with your doctor. Your body deserves the best care, and that starts with you. Stay tuned as we uncover the truth about these common yet potentially harmful health checkups. 1. Routine colonoscopies for all. Colon cancer is a serious concern, but should everyone over 70 undergo a colonoscopy? Colonoscopies have long been considered the gold standard for colon cancer screening. However, a growing number of doctors, especially those specializing in digestive health, are advocating for a more personalized approach. They argue that routine colonoscopies for all individuals over 70 may not be as beneficial as previously thought. Instead, they propose that the decision to undergo a colonoscopy should be based on individual risk factors such as family history, lifestyle, and previous screening results. This change in perspective is backed by research that suggests over 70% of colonoscopies in people over 70 are unnecessary, exposing them to potential risks and costs without significant benefit. Doctors like Dr. Michael Fishman, a leading gastroenterologist, emphasize that while colonoscopies are effective in detecting and preventing colon cancer, they're not risk-free. The procedure can cause complications like bleeding, perforation of the colon, and infection. Additionally, the sedative used during the procedure carries its own risks, especially for those with underlying health conditions. 2. Routine blood pressure medication. For many years, doctors have routinely prescribed blood pressure medication to anyone over 70 whose blood pressure readings fall above the normal range. However, a significant shift in thinking is emerging among doctors. Many now believe that treating mildly elevated blood pressure in seniors with medication may do more harm than good. Instead, an increasing number of doctors are recommending a wait-and-see approach, closely monitoring the blood pressure over time rather than immediately jumping the medication. This change in perspective is driven by several factors. First, studies have shown that the benefits of blood pressure medication may not be as significant as previously thought, especially in older adults who don't have other risk factors for heart disease. Secondly, doctors are becoming more aware of the potential side effects of blood pressure medication, particularly in the elderly. These medications can cause dizziness, fatigue, and low blood pressure, which can lead to falls and fractures. Additionally, the constant need to refill prescriptions and the potential interactions between multiple medications can be burdensome for seniors. 3. Routine screening for atrial fibrillation. Atrial fibrillation is a common heart condition that affects millions of Americans. It causes an irregular and often rapid heartbeat, which can lead to other health problems like stroke. As a result, doctors have long recommended regular screening for atrial fibrillation, particularly in older adults. However, a growing number of doctors are challenging this routine approach. They argue that the benefits of screening for atrial fibrillation may not outweigh the potential harms, especially in older adults who don't have other risk factors for the condition. According to Dr. Gregory Marcus, a leading expert in cardiac arrhythmias, the screening tests for atrial fibrillation, such as electrocardiograms, EEGs, and Holter monitors, can be inaccurate, leading to false alarms and unnecessary treatment. Moreover, the treatments for atrial fibrillation, including blood-thinning medication, have their own risks, especially in older adults who may be more prone to bleeding. If you find this information helpful, please give this video a thumbs up. Subscribe and share it with your friends and family. Now let's continue. 4. Routine chest X-rays for lung cancer screening. For many years, doctors have recommended routine chest X-rays for individuals over 70 to screen for lung cancer. This practice was based on the assumption that early detection of lung cancer can improve treatment outcomes. However, a growing number of doctors now believe that routine chest X-rays may not be the best approach for lung cancer screening in older adults. They argue that the potential harms of chest X-rays, including exposure to radiation, may outweigh the potential benefits, especially in individuals without symptoms or a history of smoking. 5. Routine bone density tests for osteoporosis. Osteoporosis is a condition that weakens the bones, making them more prone to fractures. As a result, doctors have often recommended routine bone density tests for women over 70 to screen for the condition. However, some doctors now believe that routine bone density tests may not be necessary for all older women. They argue that the potential harms of the test, including the use of radiation and the potential for false positives, may not be worth the benefits of early detection. Instead, these doctors recommend focusing on preventive measures such as weight-bearing exercise and a balanced diet to maintain bone health. It's important to note that while these checkups may be unnecessary for many individuals, they might still be beneficial for others who have specific risk factors or symptoms. The key is to have an open and honest conversation with your doctor about the potential benefits and harms of each test and make a decision together that is right for you. If you found this information helpful, please give this video a thumbs up. Stay healthy